What is hemorrhoid banding? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Tina Nunziato, and with me is Dr. Liz Cruz. Welcome to your show, Dr. Cruz.
Thank you, Tina.
For those of you that are watching us on YouTube, we are actually podcasting at night.
Yes.
We're going to call this our night podcast. We have very special night lighting. This is a very high budget situation here.
It is.
I don't know for those of you that have noticed or have been watching us on YouTube, this is pretty high budget around here.
Exactly.
So, anyway, thank you so much for joining us.
We spare no expense.
Exactly. If you're a new listener, welcome to the show. We love you. Thank you for joining us. If you're a longtime listener of ours, and you know how much we love you, we don't have to keep telling you week after week. All right, so Dr. Cruz.
Yes, Tina.
We are going to do another GI focus.
All right, let's
today,
do this.
Which is why I'm starting the podcast. So there have been patients asking a lot about hemorrhoid treatments and things like that.
Oh, really?
And
okay.
Yes, and so I thought we would do a GI focus on hemorrhoid banding because we have not done a GI focus on hemorrhoid banding. And there are a lot of ways to treat hemorrhoids, but the most current way is through banding. So I thought we would ask you some questions about hemorrhoid banding.
Let's do it.
All right, so first question is, what is a hemorrhoid, Dr. Cruz?
A hemorrhoid. A hemorrhoid. So basically, a hemorrhoid is, in the simplest terms, it is a swollen vein. I think that would be a great way to describe.
It's a very good way to describe
Yeah,
it.
it's just like a swollen vein. I mean, you have veins in the rectum. And we're going to keep this very generalized, but you have veins down there in the rectum. The rectum has like a really great vascular supply. Okay, it has like 3 different sources of vascular.
Meaning blood
Vessels.
supply.
Right, blood supply, exactly, blood supply. But hemorrhoids are essentially the veins that are there in the lower part of the rectum. They get swollen. You can have them internal. You can have external hemorrhoids. Sometimes the internal hemorrhoids that are inside get so swollen that they push out. And sometimes people will think, that those are external hemorrhoids when they're actually internal. But you can have both. You can have internal and external. So swollen, the veins get swollen, and that's what we call hemorrhoids.
Very good. Thank you for that.
Of course.
What is the main reason? Because there's a lot of people out there that have hemorrhoids. Ton of people have hemorrhoids. It's very common. We get a lot of patients in our office saying, I have blood on the toilet paper when I wipe. Is that concerning? I mean, obviously, anytime you see blood down there, you should always go have a colonoscopy.
Absolutely.
Just to be safe,
Absolutely.
Right? But it is a lot of times hemorrhoids.
Yes.
So talk about how people get hemorrhoids.
So people get hemorrhoids for a variety of reasons. I mean, you could be constipated. Okay, and because of the straining that you do when you're sitting on the toilet and pushing, that could cause those veins, those hemorrhoids to get swollen and to the point where you bleed. Okay, and some people bleed a lot. Some people might just have a little bit of blood. You could have hemorrhoids. I mean, we very commonly hear women tell us that hemorrhoids were a souvenir of being pregnant. And I mean, that's, I think, one of the biggest things I hear from women, as far as hemorrhoids. A lot of times when I come out into the recovery room after doing a colonoscopy on a female and be like, I'll tell them, you've got hemorrhoids. They're like, oh yeah, those are from when I gave birth to little Johnny 30 years ago or whenever. You could have hemorrhoids maybe from heavy, even just like heavy lifting, heavy pushing. So I've actually seen patients who are like with certain sports like cycling, you know, whether it's because of the seat and the way that their butt sits on the seat, you know, people, especially bikers that are out biking, you know, cycling for hours. You could have hemorrhoids if, I mean, your hemorrhoids can even get flared up if you've been having a ton of diarrhea because you've been going to the bathroom so much and sitting down that those pressure. Veins, the pressure. I mean, when you're sitting down, and that's one thing is that when you're going to have a bowel movement, get in there, have your bowel movement, get out.
Get off the toilet.
That's right. Don't read a book. Don't, I mean, I mean, I get it.
Well, this just started with one of our children.
Yes.
They got into this habit of taking the phone into the bathroom while pooping, and they do the bowel movement right away, but then they're on the phone for 10 or 15 minutes. Right. And we had to have this long conversation about why that's not healthy for you.
Yeah, right. Absolutely. I've had people come in that do a lot of driving. Truck drivers, you know, truck drivers that come in and that are they're sitting all day long. That's part of, hours on end in their vehicle driving. And so sometimes they'll have hemorrhoids. So there's a lot of different reasons why those veins in the rectum may become swollen and cause some issues.
And then talk about when you have hemorrhoids, what happens? Like, what could happen if you have a hemorrhoid in terms of blood on the toilet paper? What are some of the other things?
I would say the most common thing we hear is bleeding. Bleeding and sometimes, and also discomfort, okay? Especially if the hemorrhoid is protruding out. Just if they get really swollen, sometimes people will say, they feel pressure, they feel discomfort. But I would say by far, bleeding, some blood on the toilet paper, or even bleeding, filling up the toilet bowl with blood. Listen, you can really bleed from hemorrhoids. You can really bleed. Sometimes people will develop a hemorrhoid, especially like on the outside, that ends up bleeding on the inside of the head. Like basically that develops like it bleeds on the inside, it develops a clot, and that can be very, very painful. And sometimes those patients have to go and see a colorectal surgeon who will then lance the clot just to release it, so that because it's the pain from the pressure that the clot is causing is what's causing the pain.
And how do you diagnose a hemorrhoid? What are some of the techniques that are used?
I mean, we can diagnose, doing a rectal exam. When we do a rectal exam, I see hemorrhoids when I'm doing a colonoscopy. I always, do a good evaluation of the outside of the butt, the outside of the anal area. Before I put the scope in, I do a rectal exam, and then I put the camera in. But during a colonoscopy, I will see hemorrhoids in the office. And I would say that, that's the main thing. I mean, look, you can pretty much tell, like if somebody tells me, every once in a while I see blood on the toilet paper, I've had blood on the toilet paper over the past week, I pretty much know it's a hemorrhoid, okay? However, like Tina said at the beginning of this podcast when we started talking about this, any blood for us, if somebody comes in reporting any blood, we always scope them just to make sure, okay? I did have, many years ago, I had a patient who had been being treated for hemorrhoids and continued to be given different treatments for hemorrhoid, and was also having some anal discomfort. But they kept telling her, it's your hemorrhoids, it's your hemorrhoids. And I don't remember how, at what point she landed in my office. I saw her as a patient, and it turned out she ended up having anal cancer. Okay. So I have found rectal cancers in people in their 20s. Okay. So for me, with the experiences that I've had in finding cancer in such young people without risk factors, with no family history. Okay. If anyone comes to us and they have rectal bleeding, any amount of rectal bleeding, we're going to offer them a colonoscopy.
So then, okay, so let's move from there. You've done the colonoscopy. They don't have cancer.
Right.
We find it's hemorrhoids.
Right.
Okay. Talk about some of the treatments, like some of the more simpler treatments first, and then we'll get into kind of what they used to do with removing the hemorrhoids versus banding.
So just very simple stuff would be making sure that you're drinking plenty of water, making sure you have plenty of fiber in your diet, okay, to keep you regular. A lot of, constipation is a really very common, it's a big cause of hemorrhoids, because people are pushing and straining to try to get the stool out, and that causes those hemorrhoids to flare up. But making sure that you're getting plenty of water, lots of water, fiber in your diet will help to keep you nice and regular, okay?
What about the creams and stuff? Do those work?
You can get creams. You can buy creams over the counter. You can get Preparation H type creams. And, a lot of people use those and get relief with those. Some people use them and don't get relief and end up coming to us, and we end up a lot of times sending them over to the colorectal surgeon so that they can then offer them more treatment, other treatment options other than just medical. You can also, they have suppositories. We can prescribe like a hydrocortisone type suppository. It's not a hydrocortisone, but it's like it's a suppository that does have some cortisone in it, because that'll help with decreasing the swelling of the hemorrhoid.
What about Epsom salt baths?
Sure. Yeah. In fact, I'm glad you said that, because that's another thing that that through the years we'll tell. I've always told my patients, do baths, sitz baths. Get in the bathtub. If you have a bathtub, fill it up with warm water. You don't want to burn yourself, but you want it to be somewhat warm. You could put Epsom salts in there and sit in there for 15-20 minutes. If you could do that 2-3 times a day, for several days, that'll also help to with the swelling to kind of soothe those hemorrhoids.
So talk a little bit about what they used to do for hemorrhoids with the surgery, where they would remove people's hemorrhoids, and then talk about maybe why people are leaving that strategy and going to more banding.
Sure. I mean, and there are still surgeries that occur for hemorrhoid removal. It can be a very painful surgery. Honestly, I haven't had a patient who's had hemorrhoid surgery in years, okay? But it used to be like the big thing.
The main thing.
It used to be the big thing, but it's been wow, it's been, I don't know, probably over a decade. I don't know how long, but it's been years and years now that if a patient is not responding, they're on getting a lot of fiber, they're having good bowel movements, and they're still having issues, and they've tried the creams, suppositories, whatever, and still having issues with their hemorrhoids. At that point, we'll send them over to the colorectal surgeon for consideration of other treatment options. And one of the biggest ones is banding.
It's banding. So talk a little bit about what is banding. First of all, and the other thing I want to say before we get into banding with the hemorrhoids, we actually have that cushion down there for a reason.
Right.
Right? And so when you have a hemorrhoidectomy and you lose that cushion, now there's the other issues can happen.
Sure.
Right? So I think that's why a lot of people who've had their hemorrhoids removed are like, oh, I wish I didn't have my hemorrhoids removed completely, right? So that's when this strategy of banding came in, is okay, let's not remove the hemorrhoid, let's just shrink it down and keep it down. So talk a little bit about what is banding.
So banding, I mean, you're basically going down like to the base of the hemorrhoid and putting a rubber band. I guess the best example, or the best, I think, example would be where you like there's these like goats or I don't know, I remember hearing stories about animals where they would go to try to get for whatever reason try to get rid of a testicle or something and put a rubber band around it, basically like to cut the blood supply and to, you know, shrink it down or get it to fall off. I don't know if it would fall off, but basically what you're doing with hemorrhoids is cutting the blood supply off and just you know, to try to get it to shrink down, and you end up getting formation of some scar tissue in that area also. But basically trying to shrink them down, and it's actually very effective and such a great alternative to having a surgery where they go in and actually remove them. I mean, I never had a patient come back after hemorrhoid surgery.
That was such a good decision.
That was amazing. Yeah, I mean, I remember patients who would have these, you know, I think that when I started practicing gastroenterology, I was probably coming in towards the end of the chapter in medicine where people were getting hemorrhoid treatments, because I only remember a handful of patients coming in and saying, oh my goodness, I had my hemorrhoids surgically removed and it took like 3 months to recover. Yeah, and then it seems like banding was becoming more and more popular, and yeah, so it's really a beautiful, beautiful treatment for patients. Patients do really well. You know, as far as having surgery, I think at this point it's really reserved for people that have had multiple banding sessions and are still having issues.
And the banding can be done in the office.
Yeah.
Right? You don't have to be knocked out.
No, you can do it right there in the office.
So explain how it's done, just at a really high level.
Yeah, so basically you have a little scope, it's an anoscope that you go in with to take a look at the major hemorrhoids. There's like three
quadrants.
Three major hemorrhoids that you're looking at with this anoscope to try to determine, okay, which one is the bigger, juicier one that I'm going to start out with.
Because you do one at a time.
You do one at a time. And then once you've taken a look at the anus, and you know, you want to make sure that there's nothing else. And presumably by now that patient's already had a colonoscopy. And so you know that there's nothing else going on. And then once you do that, then you have your little device where you've loaded the band onto, and you literally are going to put this device in, aiming to inside. Okay, so you're going through the anus into the rectum, so the lower part of the rectum, and you're aiming towards where that hemorrhoid is that you just visualized with your eye. And you're literally going to pull the plunger to suction some of the tissue into the device. And once you pull that, then you deploy the rubber band, and now you basically have the rubber band around that tissue like a little cherry.
Yes.
Yeah.
Very nice visual.
Did you like
If
that?
you're not watching this on YouTube, please go watch this on YouTube.
That's right. That's right. Right. And so it's actually a very cool.
Yeah, and patients typically, like you said, no pain, you know, for the most part.
For the most part, they do, yeah.
They might
maybe
feel a little
pressure,
discomfort,
some
and
pressure. Yeah.
Sometimes if they are feeling discomfort or pressure, we give them a cream that they can put on it while they're
exactly,
while
like a little ointment.
Shrinking. Yeah.
Yeah.
But then they come back. How long does it take for them then to come back to do the next one?
They could come back. I mean, they could come back within, you know, 2 to 3 weeks. I think we were bringing them back between 2 to 4 weeks, probably for the next session.
And there are people who have like maybe 4 that they have to take care of.
Yeah. I mean, one of the colorectal surgeons that we refer to, I mean, tells me that yes, there's those 3 major ones, but then you still have other little veins that that you can treat, and so you could theoretically put several bands. However, when we put bands, I mean, so for us, we were at one point doing it in our office. We were just putting on 1 band at a time, okay? And then we would bring them back. I mean, the way we were trained was to only put one band because the person that trained us, the doctor that trained us, said, look, if you put 2 bands on there, and now you've got like these 2 little cherry structures with 2 bands, that might create a pseudo kind of like obstruction in that area where that patient might have some difficulty having a bowel movement because now that you've got those 2 things.
There's a lot of stuff down there.
Yeah. So, but it's possible the colorectal surgeons maybe put more than 1 or 2 bands, maybe 3 at a time. I think that's, I believe that they probably do that, but we were taught just to put 1 band on at a time.
Okay. All right. Well, thank you. Yeah. Anything else about banding, hemorrhoid banding that you want to share?
No. I'm just like thinking as I'm talking, I'm like, oh, I should like find out if I can be putting bands on during a colonoscopy.
Oh, actually, yeah.
At the surgical center, because
just right while you're there.
Just put it right there. I mean, the patient is sedated, and
that'd be great for the patient,
right?
They'd be like, thank you, Dr. Cruz, for taking care of that while you're in there.
Yeah. So, anyways, just thinking, just strategizing in my head as we're podcasting.
Nice. Very good. Well, thank you so much for that. I hope somebody learned something from this podcast. And we'd love to connect with you. So for those of you that are looking to connect with us, please go to our website. On the homepage, you'll see a magenta button. You can sign up for a free 30-minute wellness consult with us. You can also always call our office if you're in the area. We're in the Phoenix metro area. You're interested in setting up an appointment to come in and see us as a patient. You can email us at support@drlizcruz.com or call us at 623-772-6999. Also, we just ask that you subscribe to this show so you never miss an episode. And please give us 5 stars because it'll help other people just like you to find us. So thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.